Hi, good morning everybody. I'm Dr. Bobby on behalf of New Age Cosmetic White EdTech Healthcare Consultancy. I welcome all of you to continuing lectures. Today we continue on the topic of cancer. We have patient education publications, and on this page we have topics such as childhood cancer, clinical trials, coping and support for family and caregivers, screening, survivorship, tobacco cessation, treatments and side effects, types of cancer, viewing and downloading help. So before we proceed, let's give all credits and express our gratitude to the National Institute of Health and the National Cancer Institute for giving this great helping hand of helping us to make others aware through this awareness portal. We, on behalf of my firm, I hope I can do this little to help promote treatment of this dreaded disease, to mitigate the inconveniences in children and adults. Today we cover childhood cancer and related aspects. So to start with, the subject would be childhood cancer. We have the first topic will be childhood cancer, and children with under that would be topics of interest such as children with cancer, a guide for parents. We have clinical trials, taking part in cancer care, treatment, research studies, and how you can help medical research, donating your blood, tissue, and other samples. Coping and support, coping with the advanced cancer choices for care near the end of life, taking time, support for people with cancer. When cancer returns, support for people with cancer. For family and caregivers, caregiving for the caregiver, support for cancer caregivers. When someone you love has completed cancer treatment, and support for caregivers. When your brother or sister has cancer, a guide for teens. When your parent has cancer, a guide for teens. When someone you love is being treated for cancer, support for caregivers. And when someone you love has advanced cancer, support for caregivers. In screening, we have understanding breast changes and conditions, a health guide. Understanding cervical changes. Then comes survivorship, where you deal with facing forward, life after cancer treatment, facing forward, making a difference in cancer. Tobacco cessation is clearing the air, quit smoking today. Treatment and side effects will be chemotherapy and support for people with cancer. Eating hints before, during, and after cancer treatment. Cancer pain control, support for people with cancer. Radiation therapy and support for people with cancer. Types of cancer, anyone can get skin cancer. Viewing and downloading help. Right, so now we go on to dealing with topic after topic, right? The first topic we deal with is children with cancer, a guide for parents. So if your child has cancer, this guide can help you every step of the way. This guide can be printed as a PDF booklet or viewed as an EPUB or Kindle book by simply clicking on one of the boxes below. So just got to tell you what you can do for furtherance of your awareness. So I am enumerating that. This guide is divided into 5 sections. We have diagnosis, where types of childhood cancers, diagnosing and staging cancer, talking with your child. The next will be treatment, hospitals that specialize in treating children with cancer, clinical trials, cancer treatments and side effects, common health problems, infection, nutrition, stress and pain, support, finding ways to cope and stay strong, helping your child to cope, helping brother and sisters, getting organized, a life after, that survivorship with and the follow-up care. If treatments aren't working, looking forward. Resources would be practices that help children, integrative medicine approaches, medical tests and procedures. Each section also has quotes from parents related to resources and questions to help you get more in-depth and personalized information. This guide is designed to be used as a tool in consultation with your child's healthcare team. And the information here was last updated in September 2015. So related products will be a promotional flyer to health professionals to give to parents. We'll look into that as well once we finish the details. Let's open up the PDF and just study on that. Right. So, right, this is for children with cancer, a guide for parents, and right, proceeding with children with care, a guide for parents. Here we go. Right, these are just illustrations for your understanding. Right, and as we move slowly through the various depictions, we go into the subject matter proper. Right, and we start off with the guide. First will be an introduction, then we have types of childhood care, childhood cancer, diagnosing, staging cancers taken with your child, diagnosis, treatment and support, then life after that, resources, right? And okay, as we browse through the details, we have the patient and doctor details. So as we enter, let's give a readout through the acknowledgements. We would like to thank the many pediatric oncologists, nurses, social workers, dietitians, and other healthcare professionals who contributed to the development of this guide. We are especially grateful to the parents of children with cancer who shared their experiences and insights in order to help others. Please note that for easy reading, we alternate between he and she to refer to a child with cancer. Right, an introduction. Right, when we first learned Lily had leukemia, we walked around in a daze for weeks and barely slept. After the initial shock, we decided to learn all we could about this type of cancer. We also joined a support group at our hospital. Lily is a fighter. It has been 5 years now, and she is cancer-free. So isn't that great news? Right, being told that your child has cancer is extremely difficult. It's understandable. Right? Now, I'll just magnify that a little for you. Right, so many parents say they felt overwhelmed and are confused in the first days and weeks after their child's diagnosis. This guide has both medical information and coping advice that help you and your child and your family. Keep in mind, you are not alone. Your child's treatment plan has many specialists who will care for the physical and emotional needs of your child. They will also help support your family during this difficult time. More children than ever before survive childhood cancer. Most parents have good reasons to be hopeful that their child will get better. Knowledge is power. Many people and resources are available to help you learn about the type of cancer your child has, how it's treated, and what to expect. This guide aims to give parents practical support that can help you find a doctor, talk with your child, help your family to cope, organize medical and insurance information, learn about and to learn about additional resources. It also includes information to help you learn more about specific types of childhood cancer, tests and procedures, treatments and clinical trials, health issues during treatment, steps to take if treatment isn't working, and survivorship. This guide can also be viewed online or printed. Types of childhood cancer. Learn about the exact type of cancer your child has and how it's treated. Some or even much of what you've heard about cancer would not apply to your child. We felt better that when we knew how treatment could help our child. So these are things that any of us could face. So just in case, I hope, and God forbid such things happen, but just in case it happens, let's be aware that there's a lot of help around. Whether you're here in India or overseas, you have a lot of help at hand. Just be informed that this is available. So the NIH, along with the NCI, doing a great job. Let's thank them, and all courtesy to them and their wonderful staff, administration, for giving this large and valuable amount of information and general awareness about cancer treatment and after, and all the follow-ups and all the goodness it carries around with the treatment available, right? Now, this section provides general information about childhood cancer. Here are some points to consider as you start to learn more. Cancer is a group of many related diseases, not one disease. The word cancer is used to describe a group of diseases in which abnormal cells divide without control, invade nearby tissues, and spread to other parts of the body through the blood and lymph systems. Cancer in children are different from cancer in adults. The parts of the body in which cancer occurs most often are different from children and adults. The most common childhood cancers are leukemia, brain and other central nervous systems, tumors, and lymphoma. Together, these cancers account for more than half of all cancers diagnosed in children, but only a small percentage of the cancers diagnosed in adults. The causes of childhood cancer are not well understood. And we have a description and illustration here. It's more about cancer. Normal cells grow and divide in an orderly process. The body makes more cells only when it needs them. When normal cells grow old or get damaged, they die and new cells take their place. Abnormal cancer cells grow and divide in an uncontrolled fashion. For example, new cells form when the body doesn't need them, and the old damaged cells don't die when they should. Cancer cells can invade and damage nearby tissues and spread to other parts of the body. The spread of cancer from one part of the body to another is called metastasis. Children of ages and economic backgrounds. The causes of childhood cancer are not well understood, although a small number of cases of childhood cancer are due to genetic abnormalities. The causes of most childhood cancers are unknown. Children of all ages and races and economic backgrounds get cancer. More children survive cancer now than before. That's very great, good news, right? And new and better treatment helps many children with cancer. Today, more than 80% of children and adolescents under the age of 20 who are diagnosed with cancer survive for at least 5 years after their diagnosis. However, survival rates for some childhood cancers are still low. Much of the improvement in childhood cancer survival rates is due to clinical trials that have taken place over the past 4 decades. Terms of specialists Teams of specialists treat children with cancer. These teams are most often found at university or children's hospitals that are members of the Children's Oncology Group. Right, and going on to the next part of it, childhood cancers. The most common childhood cancers include brain cancer, brain and spinal cord, beginning the tissues, right? Of the brain and spinal cord. The brain and spinal cord make up the central nervous system, CNS. Germ cell tumors most often begin in the testicles of ovaries, although they can form almost anywhere in the body. These types of tumors include extracranial germ cell tumors, tumors form outside the brain, central nervous system germ cell tumors, leukemia that starts in the blood-forming tissue of the bone marrow. Types of leukemia include acute lymphoblastic leukemia, ALL, and acute myeloid leukemia, AML, lymphoma. That starts in the lymphatic system, which is part of the body's immune system. There are several types: Hodgkin's lymphoma, non-Hodgkin lymphoma, neuroblastoma forms in the nerve tissue in the neck, spinal cord, or adrenal gland. Sarcoma is cancer that forms in the bone, muscle, or soft tissue. There are several types. Ewing sarcoma forms in the bone or soft tissues. Osteosarcoma forms in the bone. Soft tissue sarcoma forms in muscle, fibrous tissue, blood vessels, or other supporting tissues of the body. Rhabdomyosarcoma is the most common type of soft tissue sarcoma in children. It forms in the muscle tissues. Wilms tumor and other childhood kidney tumors. Wilms tumor forms in the kidney. More types of childhood cancer. For detailed information about these and other childhood cancers, we need to visit the pediatric cancer treatment summaries, the PDQ. So each summary includes information about signs of specific types of cancer, tests that may be used to make a diagnosis and treatment choices. Right? Now the related resources: alphabetic list of pediatric cancer treatment summaries and the childhood cancers. So before we go into that portion, let's see if we left anything out. No. So let's check this. Both pediatric treatment summaries. All right, for that we go to an alphabetic list of related resources. Once we're through the study portion, the introduction portion. Now the diagnosing and staging procedure. In this section, it explains how cancer is diagnosed in children. It will help you learn about what tests are used to diagnose cancer and how staging systems, risk groups, and grades may be used to plan treatment for your child and to make a prognosis. Common symptoms. The early symptoms of childhood cancer are often similar to ones that are commonly seen in other illnesses. These symptoms may include fever, feeling tired, swollen glands, or weight loss. Others, such as bruising or tender joints or bones, may lead a parent to suspect an injury. When these signs and symptoms last or are severe, the doctor may order tests to check for cancer or other illnesses. Tests and procedures. The following tests and procedures are used to diagnose cancer in children. The type of test done. Right. The type of test done depends on your child's symptoms, age, medical history, and the type of cancer doctors think it may be. A physical examination and blood tests could be equally helpful. Scans are imaging tests that make pictures of areas inside the body. Types of scans include CT scan, MRI, PET scan, X-ray, and ultrasound. A radiologist is a doctor who reviews the scans and sends a report of the finding to your child's doctor. Now, a biopsy is a procedure in which samples of cells or tissues are removed and then checked to find out if cancer cells are present. When possible, biopsies should be a biopsy is a procedure in which samples of cells or tissue are removed and then checked to find out if cancer cells are present. When possible, biopsies should be done at a hospital that specializes in diagnosing cancer in children. A pathologist will study the cells or tissue samples taken during the biopsy and write a pathology report. This report describes what the cells or tissues look like when examined with a microscope and includes the diagnosis. To learn more about the tests and procedures, the medical tests and procedures section on page 79 of the guide is available. So before the biopsy, this is a statement by the patient, so let's read the statement, just reading it out from the patient. Before the biopsy, my daughter and I learned what was going to happen. We went to a large children's hospital and that had expertise in diagnosing and treating children with cancer. Now, the next page will be questions to ask before a test or procedure. Well, which test or procedure does my child need? What will be the results? And what will the results tell us? Where should my child have the test or procedure done? How long will the test or procedure take? And when does my child need to go to get ready for the test or procedure? What happens during the test or procedure? Will my child be awake? Will my child feel discomfort or pain? Will medicines be given to help my child relax or sleep? What are the risks of this test or procedure? Questions to ask when your child receives test results. What are the test or procedure find? Would you explain what the pathology report says? What is my child's diagnosis? What type of cancer does my child have? What is the extent or severity, risk group, grade or stage of the cancer? Will more tests or procedures be needed? What will these tests or procedures tell us? Will they be painful? Who can give us a second opinion about the pathology report? The risk group, grade or stage, planning treatment. At first, as the patient says, everything was new and confusing. I was overwhelmed. Now I understand more, and if I don't understand something, I ask until I do. Depending on the type of cancer that your child has, the doctor would describe the cancer in terms of its stage, grade, or risk group. These systems explained below are used to describe how severe types of cancer are and to plan the best treatment for each child. So you can always get copies of all test results and reports used to make a diagnosis, as well as a written copy of your child's diagnosis. Risk group. For many childhood cancers, including leukemias, patients are assigned to a risk group, low, intermediate, or high, based on the child's age, clinical features of the disease, and the results of laboratory tests. For example, leukemia risk groups are based on the number of I repeat, for example, leukemia's risk groups are based on the number of white blood cells, changes in chromosomes, and whether the leukemia has spread to the brain and spinal cord. Patients with lower risk disease are more likely to have a good outcome and need less aggressive treatment than patients with high risk disease. Grade other cancers, such as brain tumors, are often grouped and treated based on what cancer cells look like when examined with a microscope. Low grade, also called well-differentiated tumor cells, look nearly normal under a microscope, grow slowly, and are less likely to spread throughout the body than high grade, also called undifferentiated or poorly differentiated cancer cells. Stage treatment for the solid tumors, such as Wilms tumor, for example, may also be based on the stage of the cancers. Staging systems use numbers and letters to describe the extent and severity of the cancer. Numbers. In stage 1, also called stage 1, the tumors are usually small and has not yet spread to other parts of the body. In stage 4, also called stage 4, the cancer is more advanced and has often spread, metastasized from the place where it started to other organs or tissues in the body, such as to the bones. Letters. The T&M staging systems use the letters T and M to describe the stage. The letter T describes the size of the tumor. N describes whether or not cancer has spread to nearby lymph nodes. And M describes whether or not metastasis, the spread of cancer, is to other parts of the body, has occurred. Second opinion. Now, some parents decide to get a second opinion to confirm their child's diagnosis. Even highly experienced doctors may have different opinions. If you choose to get a second opinion, talk with the first doctor. You will need to get information such as slides, samples, or reports from the hospital where the biopsy was done to give to the second doctor. It's common to get a second opinion, and most doctors welcome another doctor's views. Some healthcare plans require a second opinion. Other healthcare plans will pay for a second opinion if you ask for one. If your plan does not cover a second opinion, you can still get one if you are willing to cover the cost. Prognosis. Prognosis is the chance that the cancer can be treated successfully and that your child will get better. It is based on information collected over many years from large numbers of people who were diagnosed with the same type of cancer. Factors that may affect your child's prognosis include the type of cancer your child has how advanced this cancer is, your child's age, and your child's response to treatment. As you talk with your child's doctor and about your child's prognosis, keep in mind that survival statistics may be used based on all patients with a specific type of cancer, or only some of them. One statistic that is commonly used in making a prognosis is the 5-year survival rate. This rate is the percentage of people diagnosed with a specific type of cancer who are still alive 5 years after they were diagnosed. Survival statistics uses information collected from large groups of people who may have received different types of treatment. Since it takes several years to see the effect of newer and better treatments, these effects may not be reflected in current survival statistics. Because statistics are based on large groups of people, they cannot be used to predict exactly what will happen to your child. Everyone is different. Treatments and how people respond to treatment can differ greatly. Related resources are cancer staging, pathology reports, tumor grade, and understanding cancer prognosis. Now, talking with your child. My son was old enough and smart enough for me to level with him about everything. I learned as much as I could about the cancer he had, but mostly I did what parents do best. I loved and was always there for my child. This section has advised to help you talk with your child. Begin with the knowledge that you know your child best. You know what makes your child laugh, and you know what upsets your child. Your child depends on you for helpful, accurate, and truthful information. Talk calmly and directly with your child during this frightening time. Honestly said, it builds trust. Tell your child about the illness and what to expect. This will help your child trust you and the healthcare team. Children who are not told what is happening or why are often fearful and may imagine the worst. Work together with the people on your child's healthcare team, such as social workers and child life specialists. Social workers are professionals who talk with people and their families about emotional and physical needs and help to find them support services. Child life specialists are healthcare professionals who are trained in the development and psychological needs of children and who help children understand and cope with the medical issues. Information for children of different ages. Your knowledge and insights about your child combined with your healthcare team's expertise can help your child. Learn about the cancer, how it will be treated, and what to expect during treatment. Manage and deal with painful treatment procedures. Cope with feelings and get social support. Have some control over the situation. Know they are loved, supported, and surrounded by people who care about them. If your child is less than a year old, comfort your baby by holding and gently touching her. Skin-to-skin contact is ideal. Bring familiar items from home, such as toys or a blanket. Familiar sights and smells can help your baby feel more secure. Talk or sing to your child. Sense the sound of your voice is soothing. Try to keep up feeding and bedtime routines as much as possible. I found that just humming to my baby and humbly, gently rubbing her feet kept her calm during blood draws. If a child is 1 to 3 years old, very young children understand things they can see and touch. They fear being away from their parents and want to know if something will hurt. Toddlers would like to play, so find safe ways to let your child play. Toddlers also like to start making choices, so let your child choose a sticker or a flavor of medicine when possible. Prepare your child ahead of time if something will hurt. Not doing so may cause your child to become fearful and anxious. Now, toys in the playroom at the hospital kept Riley busy. While we waited to be seen by the doctor, we also brought a backpack full with some of his favorite toys and his blanket. If your child is 3 to 5 years old, to help your child understand his treatment better, ask the doctor if he can touch the models, machines or supplies, tubes like bandages or ports ahead of time. If a test or treatment may hurt, prepare your child in advance. You can also distract your child and try to take her mind away from the pain by reading a story or giving her a stuffed animal to hold. We found a picture book about the hospital. Jamie wanted us to read it all the time. We still have the book, even though she's completed treatment. If your child is 6 to 12 years old, school-age children understand the medicines and treatment help them get better. They are able to cooperate with treatment but want to know what to expect. Children this age often have many questions, so be ready to answer them or to find the answers together. Talk with your child's doctor or nurse for answers to different questions or situations. Relationships are important to help your child to stay in touch with your friends and family. John just turned 11 and he is really interested in how treatment works. He always asks questions. He's always asking questions. He tells his big brother not to worry, that he will be fine. His doctor says he will make a better day, he'll make a great doctor one day. If a child is a teenager, teens often focus on how cancer changes their lives, their friendships, their appearance, and their activities. They may be scared and angry about how cancer has changed their life and isolated them from their friends. Friendships are very important at this age, so look for ways to help your teen stay connected to friends through texting, emails, online video chats, letters, pictures, and visits. Some teens use social media sites to stay connected to friends. A teen may need Your teen may feel the cancer has taken a lot of her freedom and privacy away. She may need to depend on you at a time when she is trying to become her own person. It would likely help to give your teen some of the space and freedom she had before treatment, and encourage independence. Make sure your teen is included in treatment planning and other choices. Some teens with cancer feel as if nothing could ever happen to them, and others have fears about death. Your teen may try to protect you and others they love by holding in their feelings. Don't assume you know what your teen is thinking. Take time to observe and listen. Many people, teens included, have trouble sharing their thoughts and feelings. Sometimes it may be easy for your teen to confide in a friend or a member of the healthcare team than in you. Here, Jackie is 14 and really social. She sees her friends between chemo treatment cycles. They do normal teen stuff, watch movies, play video games, hang out. This weekend they made a poster using photos they've taken and pictures from magazines. We put it up on our wall. It was good to hear laughter coming from the bedroom again. And now we have questions from parents. We have a picture of Jackie, right? Questions from parents. Although you want to be honest and helpful, you may know what to say or when to say what it takes to keep them. And your child will learn a lot from your tone of voice and facial expression. So to stay calm when you talk with your child. Work to be gentle, open and honest. Being open and honest will allow your child to trust you and feel comfortable confiding in you. Use the suggestions below to get started. You may also want to refer to information for children of different ages on section on page 8 to learn more. On days when I couldn't be strong for myself, I was strong for my child. Right? These are instances that you just need to know. Now, why should or who should tell my child? Many parents receive their child's diagnosis from the doctor at the same time that their child learns of it. However, if you choose to be the one to tell your child's doctor or nurse can help you decide what to say and how to answer your child's questions. When should my child be told? Your child should be told as soon as possible. This will help build trust between you and your child. It does not mean that your child needs to hear everything all at once. What should I tell my child? The information you share with your child depends on his age and what your child can understand. Children of all ages need clear, simple information that makes sense to them and makes them understand. As much as possible, help your child to know what to expect by using ideas and words that he understands. Tell your child how treatment will make him feel and when something will hurt. Explain what strong medicine and treatments have helped other children. Explain that treatments may cause changes in your child's schedule and how your child may feel. How much should I tell my child? Help your child understand the basic facts about illness, the treatment, and what to expect. It may be hard for many children to process too many details or information given too far in advance. Start with small amounts of information that your child can understand. You can share more information over time if it seems as if your child will be able to understand, cope with the information. Encourage your child to come to you with questions. Use your child's questions as a guide to understand what is on her mind. Children often use their imaginations to make up answers to unanswered questions and may feel the worst. Answering your child's questions and having honest, ongoing conversations can help your child. Telling untruths can cause your child to distrust you or people on their healthcare team. Now, how might my child react? Each child is different. Some worry, others get upset or become quiet, afraid or defiant. Some express their feelings in words, others in actions. Some children regress to behaviors they had when they were younger. These are normal reactions to changes in their life as they know it. Their schedule, the way they look and feel, and the friendship may all be changing. Expect that some days will be rough and others will be easier. Tell and find ways to show your child that you will always be there for her. What can I do to help my child cope? Children take cues from their parents. So being calm and hopeful can help your child. Show your love. Think about how your child and family have handled difficult times in the past. Some children feel better after talking. Others prefer to draw, write, play games, or listen to music. And questions from the children. Keep it honest. Keep it simple. Sounds familiar. Sounds easier than it actually is. But if you focus on these things, you and your child will be okay. Your child may wonder why he got sick and how long it would take to get better. If your child is older, he may have heard about cancer or had a grandparent who died from cancer. Many children ask what will happen during treatment and how they will feel. Your child's social worker, child life specialist, nurse, and a psychologist can help you come up with answers that will be most helpful to your child. What is cancer? The child will understand her cancer by relating it to what she already knows. So begin by finding out what your child knows or may have heard about cancer to help your child be less fearful and understand what is happening. When talking about cancer with your child, start with simple words and concepts. Your children may understand that they have a lump tumor that is making them sick, or that their blood is not working the way it should. Older children may find your explanation of cancer cells and types of childhood cancer section on page 2 to be helpful. Tell older children the exact type of cancer they have, such as leukemia or Ewing sarcoma. For example, use more medical words over time. For children of all ages, explain that cancer is not contagious. It's not an illness children catch from someone or they can give to someone else. Why did I get cancer? Some children think they did something bad or wrong or cause the cancer. Others wonder why they got sick. Tell your child that nothing he or anyone else did caused the cancer, and that doctors are working to learn more about what causes cancer in children. You may tell your child, I don't know. Not even doctors know exactly why one child gets cancer and another doesn't. We do not know that you didn't do anything wrong. We do know that you didn't do anything wrong and you didn't catch it from someone and you can't give it to someone or anyone. Will I get better? Being in the hospital or having many medical appointments can be scary for a child. Some children may know or have heard about a person who has died from cancer. Your child may wonder if she will get better. You may tell your child, cancer is a serious illness and your doctors and nurses are giving you treatments that have helped other children. We are going to do whatever we can to help you get better. Let's talk with your doctor and nurse to learn more. How will I feel during treatment? Your child may wonder how he may feel during treatment. Children with cancer often see others who have lost their hair or are very sick. Talk with your child's nurse or social worker to learn how your child's treatment may affect how your child looks and feels. You may tell your child, even when two children have the same types of cancer, what happens to one child may not happen to the other one. Your doctors and I will talk with you and explain what you know and what to expect. And we will explain what we know and what to expect. We will all work together to help you feel as good as possible during treatment. And the next is about hospitals that specialize in treating children with cancer. We found a doctor who specializes in treating the type of cancer that his son has through the Children's Oncology Group, a network of hospitals with amazing childhood cancer experts. His son likes his doctor, and we trust her. He completed treatment and is doing well. All right. After learning that your child has cancer, you will need to decide where to have your child treated. Sometimes children who are diagnosed with cancer need to start treatment right away. However, when possible, it's often valuable to seek a second medical opinion. This section helps you learn about hospitals that specialize in treating children with the cancer, how to get a second opinion, and tips for working with your child's healthcare team. Choosing where to have your child treated. Excuse me. Most children with cancer receive treatment at places that specialize in treating cancer in children, such as Children's Hospital, University Medical Center, a cancer center. Hospitals that have experts in treating children with cancer are usually member institutions of the Children's Oncology Group, COG. COG is the world's largest organization devoted to children research to improve the care and treatment of children and adolescents with cancer. Children's Oncology Group COG member institutions treat more than 90% of the children and adolescents who are diagnosed with cancer each year in the United States. We have similar groups in India and elsewhere too. Have more than 8,000 physicians, nurses, and other experts in childhood cancer who work at more than 200 children's hospitals, university medical centers, and cancer centers throughout the United States and Canada, and at a growing number of international sites. Participate in clinical trials, which are research studies that help doctors to develop better treatments for children with cancer. You can ask your child's pediatrician or family doctor for a referral or review an online directory of COG locations. Parents and/or health professionals can also call NCI's Cancer Information Services, CIS, at 1-800-4-CANCER to find hospitals that specialize in treating children with cancer. You may find a hospital that is a COG member institution in the city where you live, or you may choose to travel or even move for a short time to another city while your child receives treatment. Now, I'm explaining all this in this fashion. I'm taking up to this kind of a lecture because I wish to have you understand your subject and how it's being implemented when you get it to an active profession, active clinical or non-clinical aspect of your profession, and how these aspects get practically effected in routine practice for as per the conditions, and how you may go about it, and how you should interact with your colleagues and your patients, and how to carry the treatment forward and help them have a better day, a better life, right? So everything's incorporated in that, and this entire aspect. So you need to participate in clinical trials, which are research studies that help doctors to develop better treatments for treatment with cancer, for children with cancer. You can also ask your child's pediatrician or family doctor for a referral or a review on an online directory of COGS locations. Parents and/or health professionals can also call NCI's Cancer Information Services, which I just mentioned, at 1-800-4-CANCER. To find hospitals that specialize in treating children with cancer, you may find a hospital that is a COG member institution in the city where you live, or you may choose to travel or even move for a short time to another city where your child receives treatment and getting a second opinion. Now, I tell parents to have, this is a patient stop, I tell parents of the doctor telling patients as well, spoken aspect. I tell parents to have a child treated at a hospital that specializes in treating children with cancer, perhaps even the type of cancer their child has. Getting a second opinion helps us make the best decision. We decided to travel to a children's hospital that's far from our home, and we're glad we did. After you talk with one doctor about your child's diagnosis and treatment plan, you may choose to get another doctor's opinion. That is called getting a second opinion. Most doctors will support and understand your interest in seeking a second opinion. Sometimes insurance companies require a second opinion. Your insurance company can also tell you what steps to take in order to get a second opinion. A second opinion is especially helpful when the first opinion on the treatment plan comes from a doctor who doesn't specialize in or treat many children with the type of cancer that your child has. That are complicated medical decisions that need to be made. There are different treatment options to choose from. Your child has a rare cancer. The second opinion should come from a pediatric oncologist, preferably one who treats children who have the type of cancer that your child has. This doctor will usually have the most experience with and the most knowledge about the latest treatments for some types of childhood cancer. It may be important to seek a second opinion from a specialist such as an oncologist or orthopedic surgeon. This lecture will be winding up another minute or two, and we'll continue with the other relevant portions in the ensuing lecture in a couple of minutes after the first lecture is complete. All right. Now, from some types of childhood cancer, it may be important to seek a second opinion from a subspecialist such as an oncologic orthopedic surgeon. If you choose to seek second opinion, you will need to get important medical test results and reports from the first doctor to share with the second doctor. Now, the second doctor will examine your child and review the pathology report, slides, and scans before giving treatment recommendations. The second doctor may agree or disagree with the first doctor's opinion. If the second opinion differs from the first opinion, both doctors should explain why their proposed approach is better and how it is, supported by medical evidence, such as the results of clinical trials for this type of cancer. Having a pediatric oncologist or other subspecialist review your child's case can ensure that all aspects of care and treatment are considered. Often the doctor who talks with you about their treatment plan will first review and discuss your child's case with other doctors at the hospital. This is called a tumor board review or a multidisciplinary opinion, so that the treatment plan reflects a consensus of the best approach for your child from a team of doctors, right? Now, places to go to find a second opinion include a hospital that is a member of the Children's Oncology Group and the Pediatric Oncology Branch at the NIH Clinical Center 1-877-624-4878. Specialists who care for children with cancer. We got to know that people on a child healthcare team, the specialists